Hey everyone, Shannon Gonta here. I'm a professional counselor in Louisville, Kentucky. Welcome to our Ask Anything series. We have questions that have been asked by you guys and we're getting them answered by mental health and wellness professionals. And today we are here with Brittany A. Johnson. She's a licensed therapist and has a private practice in Southern Indiana. Brittany works with adult clients who have anxiety, depression, or other trauma-related disorders. She is certified in EMDR, which is eye movement desensitization reprocessing, and is working towards becoming an approved consultant. Brittany is the author of Get Out of Your Own Way, 21 Days to Stop Self-Sabotage, and she really likes to focus a lot of her work on helping women getting out of their own way and stopping self-sabotage. She works with them to eliminate their negative self-talk so they can be courageous women and do what they're being called to do. You can learn more about Brittany and follow her on social media, Instagram and Facebook, and it's at Brittany A. Johnson, LMHC. So today, Brittany, our question for you is, what does someone do if they've started therapy with someone and they just don't feel like it's a good fit? Maybe it's like a personality thing or location or for financial reasons. I don't know, but just like, what does someone do?
Thank you. First of all, thanks for having me on. I enjoy when we get together and talk. So definitely. So I'm going to kind of break that question down in a couple of parts, if that's okay.
Of course.
So at your first session, most people are very nervous about coming to therapy. And so they are unsure and they are really hypervigilant and kind of pick up on things that may not really be there. So if it's your first session and you know that you are a person that likes to do that, right? So you know that in your life, you typically like to avoid things. You're
Mhm.
going to want to kind of check yourself first to see, like, is this me avoiding again? Or is there something about this person that I'm just not jiving with? So first things first, check you just to make sure.
Mhm.
But definitely if you're sitting in across from someone, whether it's telehealth or face to face, and you just do not feel good about it, so your stomach kind of starts to hurt, you don't like what they're saying to you, or you feel like you have to explain yourself a lot more than you feel comfortable doing, then you definitely want to bring that up to the therapist. And then if it's really bad, go ahead and leave that session or just don't book another one at the end. But so that's kind of things like if you are an avoider.
Mhm.
Let's say you are several sessions in. So you had this kind of first red flag that something wasn't right, but you decided to keep going with it and checking it out, and you're at session 4 or 5, and you still have that feeling. It is definitely a good idea to, again, either bring it up to the therapist, which is what we all would want as a therapist. We want you all to tell us that it's not working, so that way we can do something to improve or help you find the right fit. But if you're not comfortable doing that, then definitely find you another therapist. Every therapist typically offers some type of free consultation. Take therapists up on that, interview them in that way, because this is an intimate process. This person is going to get down to the nitty gritty, to the root, to the inside of what's going on with you. So you want to make sure that you are comfortable with them and they're comfortable. And so again, if you feel like your therapist just personality wise is just not cutting, like you need someone that's a little bit more lively and they're more dry, and you've tried to bring it up, you got to find somebody else, unfortunately.
Yeah.
If the therapist is too direct, because sometimes, hint me,
Mhm.
sometimes I can hear what someone is saying and get too excited and I get too direct. So let your therapist know, like, hey, I like direct, but not that direct. Like that was too much. Like go ahead and let your therapist know what you're feeling, so that you and her can or him can work through that.
Yeah. Yeah, that's great. I love the kind of opening the dialogue because as therapists in the room, we're here to meet the client's goals and to work on things that, they're wanting to work on in session. It's not so much about our agenda. So if we can get that feedback of like, well, that was a little direct, we can integrate that into the sessions and work with that. And sometimes it does get to a space where there's certain things that we can't, and we do make referrals out. That's very common in the mental health field. Um, but yeah, we want to help you in whatever way, whether that's be in session with us or us getting you a provider that better fits your needs.
because again, this is intimate. The goal of therapy is really for you. This might just be the way I view therapy, but the way I view therapy, the goal is to get to the root. So you have come in, you have called because something in your life is just not right, and you're ready for that change. And so our goal is to get to the root of what that is. So we have to have a trusting relationship to do that. And so if you're uncomfortable in any way, we need to talk about that. Again, if you are an avoider, then that might be a different conversation, because sometimes, right, you're like, oh, it's a therapist. I don't like that therapist. But in reality, you're just not ready to talk about that topic. But you can say that to your therapist, like, hey, I'm not ready to go there yet. I need to stay up here at the surface a little longer, or I want to tackle something else first. I'm not ready to go to this thing yet.
Yeah.
And the therapist, if you have that relationship, they will be able to tell if this is just, again, avoidance, or if this truly is something that needs to be looked into.
Yeah. And then kind of another part of the question is like, what if it's for financial reasons? The fit with the therapist, you've been working with them forever, it's great fit, love the work you guys do, but something's come up on your end financially, insurance wise, whatever it may be. How do you navigate that conversation with the therapist if you're just not able to afford those sessions anymore? Or I don't know, is that something that you would bring up?
Definitely. Again, because this is your life, this is on you. Therapy is an investment, not just financial, but time, energy, the whole thing. And so if financial things come up, bring it up to your therapist. You might be surprised that they might offer a sliding scale, or they offer you, to do your sessions pro bono, because they understand where you're at. So bring it up to them and let them know, like, hey, this is what's going on with me, this is where I'm at. I've had several clients that have needed to drop down to like once a month as opposed to every week, because financial things have come up. And so we talk about it, we create a plan. We do update the treatment plan so that we can make sure that when we are meeting, we're hitting what they need to hit. But, if that's what you have to do, definitely talk to your therapist about it. If you're moving, because here we are, it's time for, college age people to be going to colleges. If you need to move, go ahead and talk to your therapist about, hey, are you licensed in the state I'm moving to, so that we can keep working together via telehealth? Or can you help me find someone else?
Yeah, yeah, very good. Oh, well, thank you so much for asking this question. Is there anything else you'd like to leave our audience with today?
I think the biggest thing, and I've said it over and over probably already, is this is your life, this is your time. So you want to make sure that you're getting the most out of it. And you want to make sure that your therapist, and I know someone else is probably going to answer about cultural competence, but you definitely want to make sure that you are comfortable culturally with your therapist. It doesn't mean you need to be the same from the same culture, but you want to make sure that you're not overly having to explain your life to
Mm.
your therapist. They should be able to get some of it.
Yeah, yeah, definitely. Oh, I love that. Thank you so much, Brittany. Guys, remember, she's got a book out, Get Out of Your Own Way, 21 Days to Stop Self-Sabotage. Also, podcast, right?
Yes, it's called
Yeah,
Get Out of Your Own Way with Brittany A. Johnson. It's a weekly podcast where I just kind of talk about all the things that get in our way. And so, it's not just sabotage. Sometimes it is financial, sometimes it is, things in relationships. So we just kind of talk about all of it. So check me out, follow me there, get the book, of course.
yes, yeah. And then, of course, Instagram, Facebook, you're always posting good things and good content. It's Brittany A. Johnson, LMHC. And then for
Yes.
you guys listening, if you have any questions that you want to get answered by a mental health or wellness professional, DM us and we will get them answered for you. But until next time, have a good day. Thanks, Brittany.
Bye. Thank you.